ACL stands for anterior cruciate ligament. This is important to know as women's ACL injury rates have remained unchanged for more than 20 years, and they are 3 to 6 times more likely to get an injury than males. From the article, Emerging Strategies in Anterior Cruciate Ligament Injury Prevention, from Biomechanics to Neuromuscular Training, by Fu K. Chu et al. ACL tears are one of the most common injuries among women, and around 38,000 women tear their ACL per year, making it an injury epidemic. I have researched for numerous hours finding sources that explain the whole world of ACL injuries and how it affects women's bodies. I use the University of Minnesota Library to find my sources to research these topics effectively. In this speech, I will explain the causes of ACL tears, recovery time, different types of therapies, and what sports cause most injuries in the ACL. But first, it is important to know what the function of the ACL is. The ACL plays a huge role in our knee. It is there to help stabilize the joint during knee extension and turning movements. The ACL tear is one of the most common ligament injuries. From the article, Corticospinal and intracortical excitability in individuals with anterior cruciate ligament injury and ligament reconstruction, a meta-analysis, by Courtney Santayana et al. Now that I've told you the function of the ACL, I'm going to talk about the causes of an ACL injury. Some people may think it takes a lot of force to tear your ACL, but it is actually quite the opposite. Simple movements such as sudden decelerations, jumping, and pivoting movements are some of the most common ways to tear your ACL. From the article, The Use of Augmented Information for Reducing Anterior Cruciate Ligament Injury Risk During Jump Landings, a Systematic Review, by Courtney Armientano et al. But why are women more susceptible to ACL tears than men? It is actually quite clear. Women, on average, have a 17-degree angle from their hip to their knee, which is almost 5 degrees more than the men's 12 degree. This angle causes a woman's knee joint to undergo excessive stress while even doing simple tasks such as walking and balancing. A huge thing that can cause an ACL injury is weakness in the quadriceps and hamstrings. And these are both very common, especially in women. The weakness in these muscles causes an inward collapse of the knee instead of straight on. This occurs specifically when women are participating in high-impact activities such as soccer, basketball, and running. From the article, Emerging Strategies in Anterior Cruciate Ligament Injury Prevention, from Biomechanics to Neuromuscular Training, by Fu K. Chu et al. You may notice that even while you're walking through the halls, your knee is collapsing in. This is due to the lack of muscle strength in your hamstrings. Over time, this will cause pain and make you more prone to tearing your ACL. By knowing the causes of an ACL tear, I will now talk about prevention. To prevent this, it can help to work on exercises in a certain way. We all have heard from Brooke that we need to go into the weight room and strengthen our muscles to prevent injury. But even retraining yourself to do simple tasks such as jumping can prevent future injuries that could be career-ending. The goal is to specifically focus on one movement and master it over time while doing it in the same pattern. When you practice these things over and over and over again, your muscles grow and you get stronger. It is important to exercise these muscles correctly, so having a physical therapist present, especially if you have injured yourself in the past, is really important. If you practice these things the wrong way, you can further injure yourself without even knowing it. When someone tears their ACL, it lowers limb function, it causes edema, pain, knee instability, and reduction of muscle strength. From the article, Corticospinal and Intracortical Excitability in Individuals with Anterior Cruciate Ligament Injury and Ligament Reconstruction, a meta-analysis, by Santayana et al. According to Ballerini et al., dysfunction after injury and/or surgery is closely related to changes in the strength and activity of the knee muscles and other symptoms generated by sensory changes. This quote basically explains that after surgery, the muscles in a patient's knee decrease. It is a very intensive surgery and it can take months to heal from. If the muscles aren't restored back to full strength before returning to sport, the patients are very likely to injure themselves again. And this goes for any injury in your body at all. Now that I've talked about prevention of the ACL, I will tell you about the treatment process. Over the years, treatment to the ACL, doctors have found that water-based exercises can be extremely helpful to the patient, and that they may be more effective than the typical knee strengthening activities. While doing these water-based exercises, patients have reported less knee pain and less inflammation. Not only that, but being in water makes movement of the knee easier and puts less stress on it. From the article, Analysis of Causes and Post-Operative Recovery of Anterior Cruciate Ligament Injury Caused by Aerobics in the Knee Joints by Bu Chang et al. Water-based therapies are not the only therapies out there. There are many different ways you can go about therapy depending on the patient and their injuries. I just told you about different therapies, so now I will talk to you about the process of recovering from an ACL injury. There are 4 phases of treatment after an ACL reconstruction. The first being to control pain and swelling immediately after injury. Soon after that, you want to try to do exercises that have weight bearing in them to keep your muscle strength up. Even having muscle strength before surgery is really important, and it makes you come back sooner. The second phase lasts 2 to 6 weeks, and it is focused on strength training. And then the next phase is 6 to 12 weeks, and this consists of sport-specific drills. So if you're in basketball, you want to work on cutting. If you're in volleyball, you want to work on jumping, etc. The last and final phase is a physical therapist evaluating readiness, strength stability, and injury prevention. This phase is essential to prevent a future injury in the ACL. From the article, Physical Therapist Perspectives and Clinical Practice on Assessment, Rehabilitation, and Return to Sport Criteria After Anterior Cruciate Ligament Injury and Reconstruction in Saudi Arabia by Dina Moushari et al. Many athletes return to sports too early after recovery from any injury, and this can lead to future problems. 78% of you know someone personally who has torn their ACL. From the information I gathered from the University of Minnesota, there are very similar statistics. Gorninski et al. States, among all sports, the high school female athlete has a 1.6-fold higher risk of ACL injury per athletic exposure than the male counterpart. In this speech, I explained the causes of ACL tears, recovery time, and different types of therapies, and what sports cause the most injuries. Thank you for listening to my speech.